Hope we are enjoying the program. PG students are there. How many? Oh, where is fifth? Where is fifth one? Who is missing? क्या हो गया? You know, before we start talking about the topic which we left pending yesterday evening, I would prefer if you have got any queries, issues. So let's start discussing about the topic. Do you have any queries, any questions, or any confusions? We can maybe discuss and reach to some conclusion together. Anything you want to ask? Okay. So yesterday we have been talking about this slide, and we talked about in detail onward with reference to autonomic disorders and with reference to method of practice, and then another topic which we have discussed was how to prepare a sneha indigenously on your own in your own kitchen of the Panchkarma department. And then we have discussed about the rope wala roti bal, and then we have discussed about the sweetness of arm, the expression of arm, the strength of arm, diction arm, and as according the selection of arm pachan medicine, arm pachan herb, starting from the form is very mild, then it may be warm water, fasting, then Kutu, Panchkur, Chitra, and then Malatak to next level, and then Arsani. And the highest level, the strongest of arm pachan, for your reference, for your knowledge, I mentioned that Vish Vishasya Ashram, poison kills poison, and arm is a poison. is a poison. So it is most important again to understand what is arm. So what is your understanding about arm? Arm is in simple language is raw. Arm is kacha. Made up of the word amashu. Amashu is stomach. Stomach is where raw food is being stored, undigested, not properly digested food. First reservoir of food after esophagus is arm, amashu. Arm means raw. Have you ever thought that in different diseases the arm may be different? In different diseases, arm is different. Especially all the diseases pertaining to the arm grossly can be compared with autoimmune disorders. Definition? Want to start it or close it? Start. Start. Wait, over AC चला दो. In diabetes mellitus, hyperglycemia is arm. In diabetes mellitus, what I am telling you, the raised blood sugar level, which is beyond the normal limit, is arm. In gouty arthritis, hyperuricemia, raised level of uric acid is arm. So this you can think on in every disease. When any substance in the body is beyond its normal threshold, beyond its normal limit, it may be food, then it becomes arm. Updravya, unrequired substance in the body is arm. And the most important thing while doing Panchkarma, while doing Shodhan, is the consideration, the imagination, the visualization, the kalpana of arm in deeper dhatu level. In ras dhatugat arm, rat dhatugat arm. So there is description that intermediary level arm. You have to visualize the same before starting the treatment, that arm is at level of which cut. If you will be able to understand that arm is just at the level of ras dhatu. If arm is at the level of ras dhatu, what can be disease? Sorry? Say it again. It can be amajir, simple, or it can be cholera, it can be food poison. It is just at the first level, that is ras dhatugat arm. Toxins are unwanted toxins, unwanted substances are just at the initial level, right? If you go deeper at rat dhatugat level arm, it can be amvat, it can be hyperuricemia, it can be hyperglycemia, so on. So how, and why it is important? Because if and when this concept is clear in your mind, accordingly you will be able to select the arm pachan herbs. So before I miss the strongest arm pachan, even stronger than arsenic is, normally we don't use it, but it is for your reference, it is for your knowledge, you may use it. It is snake venom. you will find many references and quite a lot of formulation. Of course, we are not using, but it is there. So, because all of you are going to do research, post-graduation thesis at some level, definitely. So you can keep it in your mind that by using the snake venom, you can do a research project. So this was a patient. I don't want to waste time on whole of the description. That patient came to our college hospital, such and such date, time, history, and she experienced loss of movement in right side of her body, noticed. All these details are, very much not very much of use for you, because you already treated these types of the patients quite a lot. So what is your first hand experience with the patients of stroke? How many of you got the opportunity to treat the post-neurological deficit of paralysis? Your experiences I am asking, with Panchkarma, of course. Anybody? You got any opportunity? You might have seen it, your teachers treating it and getting good results. You might have seen, definitely, I am sure. Had you, any of you, let me know, all of us, we are Panchkarma teachers. Anybody? Yes.
मेरा थीसिस टॉपिक जो था कंपैरेटिव स्टडी ऑफ कालावस्थी इन पर्सन।
That's great.
तो दो मेडिसिन लिए थे, एक मासोतैलम एंड दूसरा कार्पासस्टिक।
Carpasostic reference?
चक्रवर्ती।
That is having not only carpasostic but couple of other herbs.
And another reference is Sahasra Yoga.
Yes, there it is, of course.
And the Nirovasti I have used, this is the ऑयल प्रिपरेशन करने के लिए जो कसाई यूज किए थे, वही कसाई मैं यूज किया Nirovasti. And I got very good result.
How many patients you have done?
30.
20. The result was in the form of significant, highly significant.
Highly significant in case of master.
Master.
And significant in case of purpose.
You have done your PG from which college?
DGM Ayurvedic Medical College. Gadak. DGM.
Okay, nice. Sit down. Very good, appreciable. Anybody might have this type of experience, or might have seen any colleague or any teacher doing treatment? Okay. So, this is good. Do you believe that with Panchkarma we can provide a very good amount of the care to these type of the patients?
Yes.
You believe? You trust?
Yes.
This is good. And one question for you. The patients, 30 patients you took, after how much duration of stroke they came to you? How much duration of stroke, minimum or maximum, you took the patients?
6 months to 2 years.
6 months to 2 years. The patients, those after the acute management, after physiotherapy and all the treatments, those who were static, those patients. So this I want to make it clear that the results are there into these static patients. I advise you not to choose the acute patients. Let the acute patient go into the ICU. Right now,
Yes.
because we should know what is our jurisdiction. We should know what are our strong points and what are our weak points. And keep it very much clear in your mind that Panchkarma is not a magical wand. Many patients, many people, they think that with Panchkarma all the diseases are curable. It is not so. Do you have this idea in your mind? Huh?
No.
Yeah, what?
Actually, पंचकर्मा क्या करता है, जो टॉक्सिन्स है, टॉक्सिन्स को बाहर निकालने के लिए हेल्प करता है, लेकिन अप टू सम एक्सटेंट कुछ
my my submission is, it should be very clear in your mind that with Panchkarma we cannot cure every disease. Agree or disagree? So this is it. And I have conceived my own definitions of Panchkarma for a better understanding, which you will not find any textbook of Panchkarma, which you will not find in any of the on the website. So in one line definition of Panchkarma, Panchkarma is a not a very clear term. When we talk about Panchkarma, it should be very much clear into our mind that we are talking Shodhan. We are talking about Shodhan. But Panchkarma is basically not only Shodhan. So there shouldn't be any confusion. Panchkarma is not only Shodhan. Panchkarma is largely Shodhan, but Shaman also, Brihan also. Because with Matravasti, with Tarpanasya, with Anvasanvasti, but we are doing Brihan. So, to better understanding, you take a coin. One side of coin is Panchkarma, and the other side of coin is Shodhan. So it is the two faces of the same coin, Panchkarma and Shodhan, for a better understanding. Clear? So in one line, Panchkarma it helps into the auto correction of immune system. What it does? The more you will think on this line, more it will be clear to you. It is doing auto correction of immune system, not correction, auto correction, because we are assisting the body and the immune system. We are creating a type of environment into the body of the patient, which automatically helps into correction of immune system. We are getting it or not getting it? If we are not getting it, I can go into more details. Clear or not clear? For example, a patient of Amvat, a patient of gout, or a patient of any disease, chronic disease comes to you, asthma maybe, eczema maybe. The patient was not born with these diseases most of the times. They are not congenital diseases. So, you might have treated many patients of eczema, arthritis, right? And these patients are not born, most of these patients are not born with these diseases. What happens? At a certain stage of the life, the diseases they come, they manifest. So why they manifest? And what we can do with Panchkarma or Shodhan? They manifest because on one fine day, at certain stage, the threshold of immune system is broken down. What is happening? The threshold of immune system is broken down. So immune system is no more able to hold the threshold, and the symptoms, the disease, and व्याधिश तत्रो बजायते टुक्तनामि दोषनाम शरीरे वेदांतम युक्त संख्या विद्या व्याधिश तत्रो बजायते. So this is the whole process. You know, दोष दुष्य समुच्चना. You know it very well. I'm not going to go into the details of दोष दुष्य समुच्चना. So our objective is to bring back the immune system and body to a stage, to a level when this vicious cycle of arm formation, toxins formation or disruption in the immune system was not there. You getting the point? So this is the only thing which Shodhan and Panchkarma is doing. Again, it is assisting appropriately, it is assisting the body and immune system into the auto correction of immune system. And in one word definition of Panchkarma, what it can, you will tell me with your imagination. One word definition.
फिजियोलॉजिकल डिफॉर्मिटी को दूर करता है पंचकर्मा.
Whatever I want to say, it is very much weird. So if you ask try to ask to be students or to be people related with Panchkarma, they will say purification. One word. They will say detoxification. Up to certain extent it is right, but it is not completely. Rejuvenation. Most appropriately, it is doing immunomodulation. Most appropriately, it is doing immunomodulation. It is regulating the immunity, modulating the immunity. So this is the objective of Panchkarma. As far as Pakshavat is concerned, with the Vatasvyati, no disagreement. Pakshavat is Vatasvyati. Which is the main site of Vat? Who will tell me? Very simple question for Panchkarma. Pakvasya. Very true. Agree. Why? Why Pakvasya? Anybody thought? Large intestine? Pakvasya is it? Large intestine. Agree, disagree? Okay, let us say which is the second best site of Vat. Vat is everywhere in the body. Asti is also right. Second best. The number one site according to text is Pakvasya, large intestine. Second best is sweet skin, Tvak. Sorry? Sparshanendriya. Agree? So, what you never ever thought why, what's the reason? Why text, why every acharya is telling the large intestine, what to do with what? Because there is only excretion and absorption. This thought never crossed your mind. And it is extremely important to understand because the best treatment for what is Vasti. So text is right, and we are putting the Vasti into large intestine. Makes sense? Clear? But it is not the reason that Vasti is the main upakaram, main therapeutic procedure for Vat, and this is not the reason that because Vasti is effective and Vasti can be given only into the large intestine, to be Pakvasya to anal root. This is the site of Vat, main site of Vat. Vasti is giving results. Agree? Any confusion? Vasti is Ardha Chikitsa, Vasti is the Purna Chikitsa. Some texts have said Ardha Chikitsa. And mind-blowing results of Vasti are there. And when woman and virgin fails, when everything fails, when mind fails, when logic fails, we plan a Vasti, little bit of the logic, it works. You know, Gayatri? It works. And we are more like, surprised with the amount of. And if large intestine is the site of Vat, and Vasti is a recommended procedure which is efficacious also. Had you ever thought what is the mode of action of Vasti? How Vasti is working in the large intestine? What is the probable mode of action of Vasti in the large intestine, in the Pakvasya, so that it is working very fine, it is giving tremendous good results. No doubt about the results. Any doubts? So now you have to tell me how Vasti works, because this is Pakshavat. We are talking about Pakshavat. And Pakshavat is, what is Pakshavat? Whatsoever we are talking, that we are talking about the static neurological deficit after 6 months of stroke. Agree? So what is the pathology? Pathology is necrosed grey matter, necrosed area somewhere in the brain. Right or wrong? No, जी, ठीक कह रहा हूँ, गलत कह रहा हूँ? So paresis is, if there is a neurological deficit, arm is not working fine, or leg is not working fine, motor or sensory action is decreased. So this means to say, some area, some center in the grey matter of the brain, cerebral cortex is still dead. And our objective is to regenerate that addiction. Right or wrong? And it happens. I had cured many patients, those who came to me limping, many, hundreds of the patients, those who came limping, not only me but my colleagues also, Praveen also, did wonders with Avasti. You might have seen Avasti doing wonders in these type of patients, in the teachers with their own experience. Your name is? Shayantan. So he did the topic of with the 30 patients, and he had given the results, he had seen the results with his own hands and eyes. So the yaksh प्रश्न is वस्ती हम डाल देते हैं लार्ज इंटेस्टाइन में, कैसे काम करती है? I would appreciate if any of you is having any idea, any hypothesis in your brains. I'm welcoming it. I'm getting it. Anybody? Gayatri? Any idea? हाँ जी, आप शांति में
एक तो सर कॉज है Buddha is the मूला of Sharira. That's why absorption is affected.
Absorption, one concept is absorption. Good. Not completely up to mark, but very much appropriate. Absorption. So what is the difference of absorption from the stomach and large intestine and intravenous?
Water soluble.
Sorry?
Water soluble.
Water soluble?
Not in the stomach.
Say it again.
Water soluble in large intestine area.
So this is a very good answer, but I'm gonna give you a clue. Just listen to me. In my, I will be doing discussions only. I may talk anything else. So our topic may be something else. I may talk something else, and I promise I will not let you go. You might have heard when we prepare a new vasti. What are the ghatak of new vasti? Kalk is there. Again comes the question: why kalk is not a part of quath?
बात में सर उसका एक प्रिंसिपल रहता है जो भी द्रव्य रहता है, कल को हम जो यूज करते हैं वो जिस पार्ट के रूप में रहता है वो इस इंटेस्टाइन में जा करके वहाँ पे इरिटेशन का काम करता है। तो जो माइक्रोविलाई के इरिटेशन
माइक्रोविलाई
जी सर, तो वहाँ पे एक तरह का इन्फ्लेमेशन क्रिएट होता है और जो ऑब्जर्प्शन रहता है उसका रेट को बढ़ा देता है।
What's your name is?
Pushkar Rai
and Santanu, whatsoever they have told different ideas. So Pushkar Rai is telling that there takes place inflammatory process which is causing irritation, right?
Yes.
And he is saying absorption. Right? I'm telling both of them are maybe right up to certain extent, and we have to think on these lines. We have to reach to a conclusion while using both the lines. So two teachers having different ideas. One is saying that stimulation, but this is not the answer of my question. You said microvilli are agitated and they do some stimulation. I agree to certain extent, but not completely. So my question is because, what's your name? Dr. Sahil said that water soluble principles of Vasti, and my question was why kalp? Because in the quath also there are water soluble principles. You know why Acharya created a new Vasti? Why Madhu? Why Senda? Why Snehi? Why Kalp? Why Quath? Why so many different things, a mixture? कभी आपने सोचा है every substance is having a significance. So being a Panchkarma physician, a It is our duty to solve it, solve this riddle. We need to know why honey, why senda, why snake, why kalak, why what? Why not he took everything together and boiled? Maybe if honey is contraindicated to boil, it can be added into the everything what? Right? And then in the last, and when this is lukewarm, you add honey and put it in, administer the vasti. And the heat